At the Health Service Commission seats one of the founders of Save the Mothers East Africa, Professor Pius Okong. He reflected on how far Save the Mothers has come and the impact its existence has had on maternal and child health in Uganda. He walked us through the long 20 years that have shaped Save the Mothers East Africa.
How could we make it concrete to advance the agenda? And that's when the obstetricians here, then Professor Mirembe, Dr. Olive Sentumbe, myself, Dr. Jean Chamberlain, plus a few others, started thinking of different concepts. Should we just call these people of different professions together for 1 week, have seminars, run workshops? Should we get a certificate course, a diploma course, along the lines of leadership, but focusing on the starting point being maternal and newborn health? So we approached a number of universities in Uganda, public universities and private. We did not get a very good response. Some said wait. We eventually contacted Uganda Christian University Mukono in Uganda, and they were receptive and said, let's work on this idea together. And that was the basis of the founding of Save the Mothers program. Number 2, Masters of Public Health Leadership, with the core component being maternal and newborn health, safe motherhood, with a lot of support, of course, professionally here in Uganda from the obstetricians and gynecologists, professional support from Canada, support of donors from Canada as well when we're starting. The lovely thing and beauty of this program is that we bring together different professionals, those in law enforcement like the police, prisons, the politicians, the academicians, social workers, teachers, legal fraternity, who are already mature people. They come to this course, they bring their experiences, but they also bring their motivation and curiosity about maternal and newborn health and safe motherhood. The fruits and gains of this is, one, for the university. The nature of the program is that the students, as part of their training, will go out to the community and carry out some activities in the community. The university does not have a strong community outreach program, so they treasure this particular program of the Masters in Public Health Leadership and Save the Mothers, those two put together for their community outreach. And so it's a flagship, if I dare say, flagship program for the university. The alumni, when they go back, many of them go back to their jobs. Many have been promoted. They have had appointments to higher positions. They are the leaders of the health sector in districts, in other organizations, NGOs, community organizations, and so on. And this is beautiful to see how they are still passionate and carrying out this work and carrying out the leadership role to influence policy, programming, resource allocation, implementation and enforcement of laws and programs that impact women's lives. The Ministry of Health in Uganda, of course, has recognized the value and contribution of Save the Mothers program. In the recently concluded National Safe Motherhood program, we had a keynote address for this big congress of more than 700 participants, some of them from outside Uganda. The keynote address was from the Save the Mothers program, and that was delivered by Professor Jean Chamberlain. For us, this was like the icing on the cake, that to be invited to that arena to deliver to the public, to the community, to the government, what has been Save the Mothers, what is Save the Mothers, and where are we going in the future. So I really appeal to all those who are listening to look at what it has been, where we have come from, what we have achieved, and continue to support Save the Mothers in its efforts to make sure that even in other countries, not only in Uganda, we can look at the seed which is planted there, grow this in Tanzania, in Rwanda, DRC, West Africa, and so on and so forth. But also see where the maturity has reached in Uganda and increase access for mothers and children.